Okay, my name is Mukaire. I'm the Executive Director for Christian Health Association of Sudan, an affiliate of the Sudan Council of Churches, basically the development arm or the health arm of the Sudan Council of Churches. It is an ecumenical body composed and founded by 14 churches. Its mission is to build the capacity of the churches, of the Christian health service providers, service organizations, to build their capacity in providing quality, equitable, and sustainable and affordable health care. I've been with C.H.A.S since 2007. This is my 4th year.
That's great.
I've been there since its formation as a legal. My task was to create the C.H.A.S as a legal entity. C.H.A.S members contribute over 36% of the health care, and the rest is some is by government and some is by international organizations, which are not necessarily government.
So at the 36% of the facilities managed by churches, do you have to be a Christian to get served?
No, it's very inclusive. All the churches are very inclusive. The idea is to extend the healing ministry of Jesus Christ to all the communities, regardless of their sex, their creed, or their other affiliations. So these are community clinics and hospitals serving everybody within that locality. Way back in 2007, C.H.A.S did receive a grant from UNFPA to pilot adolescent sexual reproductive health program called PAL. And the program was covering only one state. It was a pilot, and in that pilot, it was adolescent sexual reproductive health, including some advocacy work with the parents and the community leaders. It included some youth-friendly services. It included increasing access to correct information and increasing their knowledge on SRH. And it also included a family planning component, particularly for the young mothers, because in Sudan, the average age at which people marry is 13 years, 13, 14. So we have so many teen mothers, and the program inevitably had a component addressing maternal health issues for teen mothers. And in that package, there was a family planning, promotion of family planning, particularly to help them to space, in order for them not to fall victim of early pregnancy and other complications that would come when it's too early.
What was in the package? Like, what was suggested to them to help them space their pregnancies?
We have promoted, we even trained peer educators and distributors. They did distribute oral contraceptives, they did distribute condoms, they did distribute other non-prescriptive methods like jellies, so like spermicides. So those are the ones we have not, and we want to, but we have not looked at other options that are there today, like the bead, the cycle bead method. And we hope that in our next campaign, we are looking at that as an option, particularly for our member groups that are affiliated to the Catholic Church. As we promote the actual family planning, we also intend to bring that in to support what we know they believe in and accept as a method for their congregations. Our organization is overwhelmed, actually. Overwhelmed in that there are so many gaps in healthcare, and there are so many. The FBOs are well positioned. Sometimes they are the only source, or could be the only source of services. But most of the FBOs are very limited in terms of capacity. We don't have enough, or even 10% of what's needed in terms of health workforce. So our organization over the years has tried to mobilize resources to sponsor Sudanese nationals to be trained as nurses or as. But this takes a while, it's 3 years, it's 4 years down the line. So the country has a lot of, most of the facilities managed by community workers right now. So the challenge is, how do you support and continuously upgrade the skills of a community health worker? And how do you provide backup? And who is the backup anyway? So these are challenges and overwhelming needs, but Sudan in general, right now, access to any form of healthcare is just up to about 25% of the population. Any form, not the full package, any form. So the need is overwhelming, and but there is general lack of skilled manpower to provide services, and yet Sudan is the second worst in maternal mortality. It's extremely high. It's above 800 for every 100,000. So we do have issues with maternal mortality, infant mortality, and to date we are struggling with how do we increase the role of the FBOs, given the fact that they have the potential and they are out there and they are the main owners of the community structures that can reach the ordinary people. So that is what we do, is to build the capacity, to give opportunities to the different churches, to training management, training programming services, setting up service delivery, and so on and so forth.